Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. As a reminder also, after the pep talk, please take the online learning com evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like this one shown here. I have placed the link in the chat box. Another reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. So this shows the voucher that I will be giving to those with 25 OLETE certificates. A request will be, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your videos, show your face now. One, two, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. The contents of the pep talk core course are shown here. Patient empowerment program, patient management process, rights in patient empowerment, and staying healthy and contented. From October 23, 2021 onwards, I've been tackling health disorder. So these are sample courses here: COVID-19, cancer, breast disorder, thyroid disorder, skin and soft tissue disorders, and health issue courses. Example of the topics here will be are the following: end of life management, palliative care, use of vitamins and supplements, patient-centered care, unnecessary operations, unnecessary medications. So this may take, I said in 2021, I said this may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. Actually, we're now on our last month to last month to October to May 15, 2024. Okay, on that day we will be completing our 3rd year. So practically we're on track and achieving our target now. Okay. So my pep talk today is entitled High Blood Pressure, Hypertension Management. The empowerment objective is for the lay people to have an essential understanding on high blood pressure or hypertension management as part of their health management. The contents of this particular pep talk will be the following: what is high blood pressure or hypertension? How do I know if I have high blood pressure? What is considered high blood pressure? What are the signs and symptoms of high blood pressure? What are the types of high blood pressure? What causes high blood pressure? What are the complications of uncontrolled hypertension? How to control high blood pressure? How to prevent high blood pressure? And what is the challenge being faced in the Philippines as regards to hypertension? So the content will be consisting of my thoughts, perceptions, opinions, and recommendations, TPORs, culled from my personal experience as well as from readings from other professionals on the topic. So let's start with the first topic here. What is high blood pressure or hypertension? High blood pressure is when the force of blood, the blood passing through the blood vessel, so if the blood is pushing against the artery walls, is consistently too high. So yung force na dumadaan sa artery ng blood ay mataas. Okay? So because of the high blood pressure, this can damage the arteries. Arteries is part of the ugat. No? There are two kinds, the arteries and the veins. Pero yung arteries ang pinag-usapan dito sa high blood pressure. So this damages the arteries over time and can lead to serious complications like heart attack and stroke and other complications such as in the kidney. Okay. So hypertension is another word for this common condition. So when you say high blood pressure, it's the same as hypertension. This is the medical term for high blood pressure. High blood pressure is a silent killer because you usually don't have any symptoms. So you may not be aware that anything is wrong kasi wala tayong nararamdaman, but the damage is still occurring within the body. Nangyayari yon, hindi lang natin naalam, hindi lang natin nararamdaman. Okay? So blood pressure is the measurement of the pressure or force of the blood pushing against the blood vessel walls, particularly the artery. Okay? And your BP reading sets two numbers, one over the other. Yung top number is what we call the systolic blood pressure. Yung sa itaas, no? Okay. Example 130 is the systolic blood pressure. Okay. And this systolic blood pressure measures the pressure on your artery walls when the heart beats or contracts. So pag nagko-contract yung heart, yung pressure on the blood on the arteries is called the systolic blood pressure. Okay. Example here, 130. No? You know. Now, the bottom number, yung nasa ilalim, no? Okay, let's say 130 over 80, yung 80 nasa ilalim, the bottom number is called the diastolic blood pressure. Okay. This measures the pressure on your artery walls between beats when your heart is relaxing. Pag naka-relax na, ano yung pressure doon? No? So, dapat mas mababa. Diba? Okay, yung sa itaas, yung habang nagko-contract yung puso natin, no? Siyempre, we expect na medyo mataas yung blood pressure doon. No? Kaya, example will be 130 over 80. Hindi siya nagpapareho. Hindi siya 130 over 130. Hindi. No? So usually, mas mababa yung nasa ilalim, yung diastolic pressure. So how do I know if I have high blood pressure? As I said, kadalasan silent yan. No? Wala tayong nararamdaman. So how do I know that I have high blood pressure? So the only way is to check through a blood pressure apparatus. Okay, so getting your blood pressure checked through a apparatus, no, either digital or manual, no, okay. This is the only way to know if it's too high. So yun lang paraan paano natin malalaman kung mataas, mababa, or normal, no? Okay. Now, what is considered as high blood pressure? Okay. So high blood pressure can be normal, can be high, can be low. Okay, so today we'll be talking about high blood pressure. So the definitions of high blood pressure vary slightly depending on where you live. Okay? Ibig sabihin, kung nasaan ka, nasa bansa ka, anong bansa, no? So in the US, they have their own standards. They consider hypertension is present kung the top number, systolic blood pressure, is at least 130 meters mercury. And you said baba naman, diastolic pressure is at least 80. So 130 over 80, okay? Kung umaabot dito 130 over 80, hypertension na sa kanila sa US. Okay, sa Amerika. But sa Europe naman, okay, ang kino-consider nila hypertension is 140 over 90. Yan ang cut-off. No? Okay. So below 140 over below 90, hindi pa hypertension sa Europe. Pero sa States, pag 130, 100 over 80, hypertension niya. No? So mas mababa ang standards, mas stricter ang standards sa US. No? Now, in the Philippines, no, ang hypertension is defined as parang nasa Europe tayo, no? Sa Europe ang ginagaya natin, no? At least 140, okay, yung systolic, and then at least 90 ang diastolic. So 140 over 90, pag meron ka nitong reading, you are considered to have hypertension. So in the Philippines. Okay. So this slide shows the similarities or comparisons of the US and then the Europe. Okay. So sa US, it says that when you want to do an accurate blood pressure measurement, you can use the office base, no, kahit sa bahay, no, measurement, and use a validated yung natetest ng calibration, the CAF devices and home, yung mga digital BP apparatus, pwede na yon, no? Okay. So gagamitin natin yon. Then try to check it every now and then kung anong readings ng blood pressure mo. Kung mataas, then we call that hypertension. Okay. Now, the initial treatment in terms of comparison, halos pareho lang, no? Yung gamutan sa Amerika at saka sa US. No? So they usually start with ito yung mga initial gamot, yung tinatawag na ACE inhibitors, angiotensin receptor blockers, thiazide, diuretics, calcium channel blockers. Okay. So maraming klaseng gamot yan. No? We will explain that later on. Now, kumisan yung mga several gamot, kino-combine nila into a single tablet. That's what is called single pill combination therapy. Okay. So for convenience of taking, para sabay na, no, in one pill, no? Kaysa isang ACE inhibitor sa umaga, and then sa gabi, angiotensin or calcium channel blockers. No? Okay, iwalay. Mas inconvenient sa pasyente. Now, ang definition ng sa Amerika, saka sa Europe, as I said, kung more 130 over 80, okay, kung equal to that or more, hypertension na. Pag sa Europe naman, 140 over 90, kung equal to that or mataas, hypertension. And then dito naman, okay, may mga ranges siya. Meron silang separate, different classification din sa stage 1, stage 2. Kung sa cancer, may stage 1, 2, 3, 4. No? This means yung extent ng cancer. Dito naman sa hypertension, they call it stage 1 in terms of the level of the blood pressure. No? Kung ang blood pressure mo is 130 to 139 over 80 to 89, stage 1. Medyo nasa milder hypertension stage. Now, kung lumampas na ng 140 and over 90, they call it stage 2. Okay? Siyempre, doon sa Europe, mag-a-adjust din. No? Mas mataas ang standard, ang level. No? So, but just remember, huwag tayo aabot ng 180 over 110. Pag umabot tayo sa 180 over 100, yan ang grade 3. Yan ang pinaka-delikado. No? Okay. Okay. Ito na, just yung mga targets na for treatment, okay, as recommended by the US and the Europe. No? Usually, they try to keep the blood pressure below 130 over 80 regardless of the age. Pero sa Europe, may konting adjustment. So, pwedeng mas matanda, medyo mas higher ang acceptable limit. No? So, 69 to 79 years old. So, tinatarget nila 140 over 80. But usually, ang bottom line is still 80. 80. Mas maganda yung diastolic na 80. No? Okay. So again, just to repeat, American standards. Okay. So normal siya kung less than 130 and less than 80 diastolic. They call it elevated, hindi pa high. May isa pa sa category, 120 to 129. Pag umabot na ng 130, hypertension na yon. And kung ang pinakamataas is 139, stage 1. Okay. Dito naman sa diastolic, no? Okay, kung 80 to 89, stage 1 na yon. Okay. So, magiging stage 2 kung 140 or higher, 90 or higher sa diastolic naman. Dito naman sa hypertensive crisis, yung pinaka-severe, pinaka-delikado, if it's higher than 180 or sa systolic and or yung diastolic naman 120. Okay? So, ito. Okay. Ito yung comparison again. Okay. So, let's now go to what are the signs and symptoms of high blood pressure. Usually, as I said, high blood pressure causes no signs or symptoms. No? Kung wala kayong nararamdaman, hindi ibig sabihin wala kayong high blood pressure. The only way in which you can tell whether what is your blood pressure is to have it checked by a BP apparatus. Okay? So you could have high blood pressure for years and do not know it. So when your blood pressure is 180 to 120 or higher, now this time you may experience, most of the time you experience symptoms like headache, palpitations, and nosebleed. So the blood pressure this high is hypertensive crisis that requires immediate medical care. As I said, this is the pinakadelikado. No? Now, what are the different types of high blood pressure? May tinatawag na primary and secondary hypertension. The primary, the causes of this hypertension, usually not known, but usually not specifically known, but usually include aging, yung tumatanda tayo, tumataas, no? Then lifestyle factors, okay? Like not getting enough exercise. Okay? Now, secondary hypertension, may specific cause na na-identify. Okay? May isang sakit sa katawan na nagkakos ng hypertension, or there is a medications that you are taking that can cause hypertension. Okay? Hindi yung mga anti-hypertensive medications, iba. Yung ibang gamot can cause hypertension. Then, if that be the case, we call that secondary hypertension. O kaya kung may sakit sa kidney, nagkakos ng hypertension, we call that secondary hypertension. So sa primary hypertension, walang specific cause except for the age, lifestyle factor. So we also have heard about high blood pressure that comes and goes in certain situations. No? So these hypertension types are the following. And ito yung tinatawag na white coat hypertension. Kung ang BP mo is normal at home but elevated in a healthcare setting, baka takot kayo sa doktor kaya tumataas yung blood pressure nyo. So yan ang tinatawag na white coat. White coat connotes yung doktor, no? Seeing a doctor in the clinic, no? Tapos baka kinakabahan kayo, no? Kaya tumataas yung BP nyo, pero kung resting, nakapagpahinga kayo, nasa bahay lang kayo, wala kayong stress, wala kayong takot, no? Usually normal yung blood pressure. Now, mass hypertension, it's the opposite of white coat, no? The BP is normal in the healthcare setting, sa office ng doctor, sa clinic, no? But mataas sa bahay, elevated at home. No? Okay. So pag kinukuha ng doktor yung BP mo, normal, no? Pagdating mo naman sa bahay, bakit mataas? So that's what is called mass hypertension. No? Then sustained hypertension, kahit saan ka, whether at home or in the office, in the clinics, no? Okay, in the hospital, mataas talaga. So this is the one that we have to really take care of. Okay. We have to manage this one. Nocturnal hypertension, minsan yung BP mo goes up when you sleep. So pag nag-awake ka, bumababa, no? Okay, tandaan na lang niyo yung hypertension nagpa-fluctuate throughout the day. No? Hindi pare-pareho every day, every hour yon, no? Nagpa-fluctuate. No? So we have to monitor those fluctuation also. Kung kailan sila tumataas, kailan nagiging normal. Oh, now, what causes hypertension? As I said, may primary and secondary. No? So a primary hypertension does not have a single clear na malinaw na cause. Usually, many factors come together to cause it. And common modifiable causes, when you say modifiable causes, yung pwedeng pang ayusin. No? Okay. So example will be unhealthy eating patterns, including a diet high in sodium. So pwedeng palitan yan, no? Pwedeng bawasan yung sodium sa diet. No? That's what is meant by modifiable. Lack of physical activities can cause hypertension, primary hypertension also. No? So pwedeng i-modify by doing exercise. Then high consumptions of beverages, mga soft drinks, then containing alcohol also, no, can cause hypertension. No? So the so-called non-modifiable risk factors, ito genetic, hindi mo genetic predisposition, wala kang magagawa dyan. Andiyan na talaga, no? AIDS, ganun din, no? Okay. Hindi natin makokontrol yan, no? Now, the secondary hypertension naman, as I said, meron siyang at least one distinct na cause, na very specific cause that the doctors can identify or what we can identify. And then the more common causes of secondary hypertension include when you take medicine like NSAID, now immunosuppressant, pills, yung mga contraceptive pills can cause hypertension. When you have a kidney disease, okay, when you have these other diseases like obstructive sleep apnea, primary aldosteronism, and then tobacco use, pwede rin, no? Yung vaping, no? Especially vaping, then this can cause hypertension. So if any one of these present, then we call the hypertension that you have is secondary hypertension. Kung wala nito, just based on the age, based on the lack of exercise, no? Yung mga obesity, yung mga kinakain mo, no? So that's what is called primary hypertension. What are the complications of uncontrolled hypertension? Kung di natin makontrol yung BP, now what will be the complications? Ang more common complications will be the following. Coronary artery disease, which can lead to heart attack. Now dito, no? Okay, eventually, no? So umpisa, parang when say coronary artery disease, medyo barado siya because of the damage to the artery, no? Sa heart artery, medyo kikipot yung artery. Yeah, it eventually it might lead to heart attack. Stroke, ganun din. Stroke doon sa brain naman. No? Kidney disease and kidney failure. So these are the more common complications that can arise from uncontrolled BP. So the conclusion here will be, and the recommendation is that high blood pressure or hypertension must be controlled. If you want to avoid, now try to avoid heart disease, stroke, heart attack, and kidney disease or kidney failure. Now, how to control high blood pressure? For the secondary hypertension, as I said, this is a type of hypertension with distinct cause. You try to eliminate the cause kasi na-identify natin. No? Yung sa primary, hindi natin matatanggal yung age factor, unmodifiable. But the other factors, we can modify. No? So, but for secondary hypertension, example, if the cause is medications, let's say you're taking mga contraceptive pills, you're taking a lot of immunosuppressants, pwedeng ihinay-hinay lang o ibawasan ng konti or totally stop the medications. No? Okay. Now, if the cause is the pills, okay, ito yung pills, yung contraceptive, you stop the pills. If the cause is tobacco use like vaping, tanggalin yung tobacco use. If the cause is the kidney disease, then we treat the kidney disease first so that we can control the hypertension. Okay. Now, for the primary, in which there is no distinct cause, or with non-modifying factor like age and gene, control of the high blood pressure can be done with a change in the lifestyle and medications. Kung di na kaya, Okay, start with the change in lifestyle. Yan ang punang recommendations that will control the hypertension. Kung di naman kaya, now if not successful, basta try your best, no? Keep on trying. Pag di kaya ng change of lifestyle, then medications will have to be added, okay? Or drugs. Okay? So change in lifestyle will be to shift to a healthy lifestyle if you're having a unhealthy lifestyle at the moment. So number one will be healthy weight, yung timbang ninyo. So don't go into obesity. Okay? Okay. Then eat a healthy diet, exercise, limit your alcohol, cut down on salt, and then get enough potassium, then control stress. So take note, stress can also cause hypertension. Okay? So take note of this change in lifestyle. Now, kung hindi kakayanin ng change in lifestyle, then you have to take medications to lower your blood pressure. Pero even if you are taking medications, you still have to try to control, to change your lifestyle into a healthy lifestyle. Okay? So 4 classes of blood pressure medications commonly used. These are the so-called first line, yung po nang binibigay ng mga doktor, because these are the most effective and most commonly prescribed. So angiotensin converting enzymes, I won't go into detail, just put the classifications here kasi maraming klaseng gamot yan eh. No? Angiotensin 2 receptor blockers, no? Calcium channel blockers, and then diuretics. Okay? So these are the commonly used anti-hypertensive medications. So it can be used singly, pwede isa dyan, or combinations, 1 and 2, okay? Or, combine yung dalawang gamot o tatlong gamot into isang tabletas lang para mas madaling inumin, no? Okay. Then once you are on the medications, what is usually being done, i-titrate lang. Kung medyo kulang, dagdagan. Kung medyo mataas, malakas yung medications at biglang bumababa yung blood pressure mo, then babawasan na lang. So to be able to titrate your blood pressure, the medications for your blood pressure, you have to monitor, okay, your blood pressure every day, every now and then adjust the medications accordingly and the dosage. No? Adjust the medications. Kung di kaya ng isa, you can change to another type of gamot. No? Okay. Then of course, while you're taking the medicine for hypertension, we have to monitor the side effects and then adjust accordingly. So if you're taking one medicine that causes edema or cramps, no, hindi mo ma-tolerate, then papalitan ng doktor yung gamot mo, no, into another class of anti-hypertensive. So ito na. So the how to prevent high blood pressure. So best effort, as there are modifiable and non-modifiable risk factors. And this is for the primary hypertension. So the recommendation is focus on healthy lifestyle to prevent hypertension. No? Then monitor regularly your BP. You may have to procure a BP digital apparatus for home monitoring. Digital na lang para mas madali. No? Then take anti-hypertensive medications as needed. Kung di kaya nang i-control ng change in lifestyle, then you have to take medications. And then take the medications as prescribed by the doctor, and then regularly with monitoring of the BP to adjust the medications. No? Okay. Here, I just put repeat this one, yung change in lifestyle, importante ito. No? While taking the medications, still shift to a healthy lifestyle or maintain it. So how to do the BP monitoring? The most practical is a digital BP monitoring device, but make sure it is accurate with good batteries. So i-check lang ninyo every now and then kung accurate yung reading. No? So at the beginning, measure your blood pressure at least twice daily. So umpisa, take it first in the morning before eating or taking any medications. Then take it again in the evening. So at least twice a day. So umpisa, each time you measure, take at least 2 to 3 readings to get to make sure your results are the same, no? Or to get the average. No? So take your blood pressure at the same times each day. When you're trying to monitor, dapat at the same time. As I said, nagfa-fluctuate yung blood pressure during the day. No? Then don't measure your blood pressure right after you wake up. Kasi usually mataas yun. No? Okay. Then avoid food, caffeine, tobacco, alcohol for 30 minutes before taking a reading. Then also empty your urinary bladder. Okay, yung pantog niyo, no? Because a full bladder can increase the high blood pressure slightly. And then when you are ready to take your blood pressure, just sit quietly before and during monitoring. Sit for at least 5 minutes in a comfortable position with your legs and ankles uncrossed. Your back should be supported against the chair. Try to be calm and not think of stressful things. Don't talk while taking your blood pressure. So naka-resting stage lang, no? So then make sure that your arm is positioned properly. Always use the same arm when taking the blood pressure. Rest your arm, raise to the level to your heart on a table, desk, or chair. You might need to place a pillow or cushion under your arm to raise it high enough. Kung masyadong mababa dun sa heart mo, no? So malalim from the level of the heart, itataas mo ng konti. Now, place the cuff on the bare skin, not over the clothing. So, dapat walang damit. No? A rolled sleeve that's tight around your arm can affect the reading. Kasi kung naka-long sleeves ka, saka maipit, no? Ma-affect yung reading. And then you may need to slip your arm out of the sleeves. Take a repeat reading, wait to 1 to 3 minutes after the first reading, and then take another. Usually, one reading is not enough. So you have to take mga 2 at least, kung pwede pa, 3, di ba? Then try to see kung malaking difference or small difference. No? Okay. Or you can take the average. No? Then take note of the following. Blood pressure varies throughout the day. Yan ang sinasabi ko, nagpa-fluctuate siya. Now, during the day, every 2 hours, every 3 hours, iba. Depende sa mood, depende sa weather condition, depende sa stress during the day. And then the readings are often, as a rule, the readings are usually higher in the morning. No? Kaya usually don't, ang advice is that you rest for a while after you wake up, huwag mo muna yung right after waking up. No? Also, your blood pressure might be slightly lower at home than in a medical office. Now, yung sinasabi natin na mass hypertension. Okay? Sa bahay, this is white coat, slightly lower. Okay? Kung normal sa bahay, pero mataas sa clinic, then we call that white coat hypertension if you are seeing a doctor. No? So what are the challenges being faced in the Philippines as regards to the hypertension? So I got this paper, okay. Ang title on prevalence of hypertension in the Philippines in the year 2050, confronting a major challenge. Itong looking forward, anong mangyayari sa hypertension problems sa Pilipinas? Okay. The prevalence of hypertension in the Philippines has continuously increased. Tuloy-tuloy yan, nag-increase in the past 22 years and for more than 2 decades from 1993 to 2015 with an increased related death due to ischemic heart disease, stroke, and chronic kidney disease. Kaya tuloy-tuloy na tumataas yung incidence ng hypertension, the prevalence, and then also yung mga namamatay dahil sa hypertension. So the findings in this paper is that the hypertension prevalence will remain high at 23% with a 28% increase in the number of cases. And it will affect the extreme of ages, no? Yung mga early 20s, pwede din tamaan, then the 80s, yung mga elderly patients in the age of 80 years old. So in addition, the actual number of deaths related to hypertension will increase more than double from 90,000 in 2015 to 210,000 in 2050. Na laki ang difference, di ba? So due to ischemic heart disease, stroke, and chronic kidney disease. So overall conclusion is that yung research shows that it demonstrates a significant increase in the disease burden due to hypertension in the Philippines in the next 3 decades up to 2050 and possibly pose a significant public health challenge. So importante yung aggressive, preventive, and health-promoting efforts. This must be carried out to to control the hypertensive cardiovascular disease in the country. So the best way to prevent, to control this hypertension problem will be healthy diet, no? And then medications, and then monitoring. No? And of course, learning something about hypertension. Kaya importante itong pep talk nito. At least give you an idea what the high blood pressure is, what is hypertension, and how it is usually being managed. So that's my last slide for the main topic. Okay, summary and takeaway. I have discussed the following. Okay. What is high blood pressure or hypertension? How do I know if I have high blood pressure? You just have to take your BP. What is considered as high blood pressure? Sa atin, 140/90. Okay. Sa US, 130/80. And what are the signs and symptoms of high blood pressure? Is pag mild na stage 1, stage 2 lang, wala kang nararamdaman. Pero pag stage 3 ka na, let's say 180/120, usually sumasakit na yung ulo mo at iba pang nararamdaman mo like palpitation and also nose bleeding. And what are the different types of high blood pressure? You have the primary and secondary. And what are the causes? It all depends whether it's primary or secondary. Kung merong specific causes like kidney disease, taking the medications, then we call that secondary hypertension. Kung wala naman, it could be the genetic predisposition, it could be the aging, it could be the diet that we're taking, and then obesity. No? Okay. Then what are the complications of uncontrolled hypertension? Ang nakakamatay dito, yung heart disease, no? Stroke, kidney problem. No? How to control? Okay. Meron yung mga lifestyle changes, then medications, how to prevent high blood pressure, basically, yung primary hypertension, usually healthy lifestyle. And what are the challenge being faced in the Philippines? Pataas na pataas yung prevalence of hypertension. We should be aware of that, and we should take note of that, and we should try to control it within ourselves and also among our family members. Dapat ma-empower natin yung mga kasama natin sa bahay, no? Yung mga kamag-anak natin. So, takeaway in relation to patient empowerment, be always in touch with reliable medical information on high blood pressure or hypertension management. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment such as kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on high blood pressure or hypertension management as part of our health management, of your health management. This ends my pep talk today on high blood pressure, hypertension management. I hope I have empowered you to have an essential understanding on this topic, high blood pressure, hypertension management as part of your health management. Before we go to the question and answer portion, okay, session, let's have a reminder, take the OLETE, okay, and have a perfect score. Okay. So the link is in the chat box. So this is a picture of the certificate that I will give you if you get a perfect score. And then obtaining 25 OLETE certificates, starting this year, 2024, will entitle you to a free voucher. So feedback, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the QA and interactions. Okay, get ready. 1, 2, 3. Right. Okay. So the floor is now open for questions, suggestions, recommendations, sharing of experience, and consultations, short consultations. Okay. How many have hypertension now? Lahat? Pati ako. Perla, Shirley, Shirley, may hypertension ka? Shirley? Wala. Ellen?
Yes, Doc.
Oh. Charlita, may hypertension ka? Charlita? Ray,
Yes, Doc.
Ray Benjamin. May hypertension si Ray Benjamin?
Wala po, Doc. Wala po.
Si Shirley, wala. Very good.
Opo.
So, Abet, wala pa.
Di ba since nung nag-ano ako, nag-COVID injection ako,
Oh,
di ba
meron ka na?
nag-200/100 yung BP ko?
Di mataas. Ngayon,
Pero ngayon 110/80 na lang.
may gamot ka.
Oo, pinag-maintain ako kasi baka daw kasi nga din, di ba, nakuha daw yun sa high blood or what. Pero lahat naman ng test, okay, except yung meron akong gallstone. Yun lang. Pero kino-continue ko.
Okay, babalikan natin yung istorya mo mamaya. Si Phoebe, may hypertension si Phoebe?
Wala po.
Very good. Very good. Maswerte. Lordy here. Lordy. Bata pa si Lordy. May hypertension ka na? Wala pa. Okay. Si Maria Justa, may hypertension na. Jeng, may hypertension ka na rin? Bakit? Ilang taon ka na, Jeng?
50.
Okay.
Magti 3 years na akong nagme-maintenance, Doc, ng gamot ko sa high blood.
Nung na-discover mo may hypertension ka, gano'ng kataas yung blood pressure mo?
Ano, Doc? 160 over 100.
Okay.
160, 150. Then, ganun nga po, 1 week akong pinag-monitor ng doktor kung tataas. Then, yung 1 week na yun, sa niya ako in-advise na mag-take ng ng gamot. Tapos, panibagong 1 week, nung nag-ano na ako, tinitingnan niya kung nababa naman po. Hanggang sa, yun po, dire-diretso na po yung pagtitake ko ng maintenance sa high blood.
Okay, yung 1 week na yon na monitor mo, hindi naman bumababa sa below 130/80.
Ano po, nagiging, ano na po siya, 120/80, 110/80, gano'n na po siya. Tapos po, ngayon, gawain ko pa rin po yung sinasabi niyo na sa umaga at sa gabi, na pag po sinisipag, nag-BBP po ako.
Okay. So ngayon, anong BP mo ngayon?
Gano'n po, 120/80. Lagi naman po maganda.
80. Okay. So hindi ka naguluhan ka na rito sa sa classification sa lecture ko. Iba-iba yung cut-off, no? Iba-ibang cut-off. Kung sa US, the reason bakit nila binabaan yan, naging stricto sila kasi they want to really control yung mga complications ng hypertension. That's the only reason, no? So sasabihin na pag 130/80, mas stricto siya, inom na kayong gamot, di ba? Ganon. O kaya change the lifestyle. Pero sa Europe, 140/90 pa rin, di ba? So, sa'yo, if you follow the Europe, yung sa atin, palagi ko, we follow the Europe standards, no? Unless I'll be corrected by somebody, I don't know, kasi di rin ako specialista dun sa field na yun, no? Kung 140/90, normal ka na, di ba? Normal na yung blood pressure mo, 120/80, di ba? Okay.
Doc, bakit po yung iba, katulad ng pinsan ko, mas sabi ko ng doktor niya, mas kailan lang po nito lang Thursday, ngayon pa lang siya pinagtitake ng gamot sa high blood. Mas maganda daw i-take yung gamot sa high blood sa gabi. Well, katulad ko, ang ginagawa ko, 30 minutes before meal, sa breakfast, saka ko siya tinetake.
Aha. Okay. Anong gamot tinitake mo sa gabi?
Hindi po, yung pong pinsan ko, ang ganun ang ano sa kanya ng doktor niya. Sa gabi niya ite-take yung maintenance niya. Bago pa lang po, Thursday pa lang po siya nag-start. Pero ako po, since po nung inano sa akin ng doktor ko yung mag-take ako ng sa high blood, lagi pong sa umaga.
Ah,
Before, ano po, after breakfast. Bakit po
yeah.
yung sa pinsan ko, gabi naman?
Okay. So I'll try to answer that. Usually pero depende sa gamot, no? Okay, depende sa gamot. Now, yung iba pwedeng inumin sa gabi, yung iba nire-recommend lalo na combination, sabihin nila sa umaga, no? Kung dalawang gamot, no? Okay. Isa sa umaga, isa sa gabi, no? Ganon. Pero usually kasi yung mga from observation, yung mga as I said, yung blood pressure tumataas even mga early morning, no? Early morning, no? Usually ganon. Kaya kadalasan yung mga nag-stroke early morning din, no? Ganon, no? Okay.
Doc, yun nga po, yung pinsan ko nga po nag-start lang nung Thursday. Ngayon po tayo nagsusumiting, nadala po siya sa doktor ngayon sa amin sa Laguna.
Aha.
Kasi nakaramdam po siya ng pangingimay ng paa, ng kamay, then yung kalahati na rin po ng ulo niya. Ngayon po, kailangan siya magpa-CT scan. Kasi para pong, ganun nga po, yung parang
Ilang
papunta
taon na
po
siya?
sa
Ilang taon na?
Doc 40, yung kasali ko sa sa BSE natin.
Okay. So, yeah, kumisan, baka beginning stroke, I don't know, no? Baka iba-ibang problema, no? So, pinapa-CT scan na siya.
Opo, kaya nabigla po ako ngayon. Gawang kasi no Thursday lang kami magkausap na ganun nga po siya. Tapos nga ngayon Saturday, halos 3 days, gayon na po kaagad yung nangyari sa kanya.
Yeah, okay. Sige. Kumisan, you just look at it this way kasi we cannot control, sometimes we cannot control all these things, no? Okay, let's just pray and hope.
Yung kung ano yung naging BP niya, sabi po niya, 190 over 110.
Mataas yun, 190, di ba?
Opo. Mataas
Mataas
po
talaga
siya.
yun. Kasi ang usual na, yung pinaka-severe, yung crisis na tawag doon, 180. Sa kanya, 190, mataas na. Sobrang taas.
Yes.
Okay. So let's hope for the best. Anong gamot ang iniinom mo ngayon?
Ako po, daily bus. 10 milligram.
Norvas, daily bus.
Daily bus po.
Kaya
Daily
nga,
bus.
ano, combination yon. Amlodipine yan
Hindi
eh.
po. Ano lang po. Daily bus lang po siya.
Kaya nga, hindi yung component nun. Kaya hindi ko ma-discuss yung mga gamot. Ang daming klaseng gamot, di ba?
Yes.
Diba?
Mm-hmm.
So, ano yun?
Uploading po siya na daily bus.
Okay, isang gamot lang yon. Hindi,
Opo.
maraming brand name kasi diyan eh. Kaya ako nalilito rin. So, okay. So, wala kang nararamdaman na cramps?
Wala naman po.
Okay. So, sa akin kasi na-feel ko nung nag-umpisa ako ng amlodipine, ako may hypertension din ako because of my age. Okay. So, pag nag-amlodipine ako, nagka-cramps ako sa umaga, early morning. Kaya dinatitrate ko na lang muna, tinitingnan, kaya nagdagdag na ako ng losartan. No? So, titingnan ko kung mababawasan ko yung amlodipine. So, tinatitrate ko lang. No? Okay. Kaya importante, i-check mo yung BP mo. No? At kadalasan, you don't, kasi yung blood pressure, you have to monitor every day, and hindi man pwedeng na every day tatawag ka sa doktor, di ba? So,
Yes.
dapat you know how to take care of your blood pressure also. Kaya ako naisipan na ipasok itong topic dito for the pep talk. No? Okay. I think everybody will benefit from it. No? Okay. So, try to read on hypertension. At least binigyan ko na kayo ng basic knowledge, no? But it's not enough. No? We just have to keep on polishing it, our knowledge, no? so that we can adjust it ourselves, no? Kasi hindi naman natin pwedeng habulin ng doctor na every hour, every day, di ba? So you may have to do some adjustment on your own, no? Okay. Okay. So ang maswerte rito, si Shirley, si Lorly, tsaka si Phoebe. Walang hypertension. That's good. The rest are may hypertension at si Perla, meron ka?
Meron po.
Oh, gaano katagal na? Age related?
Kung matagal na doktor ako umiinom eh.
Sige na,
Since siguro meron
age-related,
ng
no?
matagal na po ito. Ininom ko. Nagkapalit-palit na nga ako ng brand na iniinom.
Oo, iba-iba, no?
Pero ngayon lang iniinom ko doktor ay Coveram.
Ano yun?
Coveram 5 micrograms.
Anong generic, chemical name?
Perindopril, arginine plus amlodipine becylate.
Oh, so yan ang
Five.
example ng combination na gamot.
Yes, doctor. Anti-hypertensive and anti-CAD, coronary artery disease.
Okay. So gaano katagal mo na iniinom yan?
Matagal na doktor, siguro may 10 years na ito.
Okay. Yung
Opo.
BP mo, na-maintain naman.
Malaki siya eh.
Yung BP
Kasi
mo,
sabi, kahit naman daw normal na dok, kailangan daw uminom ka na pag nakainom ka na ng maintenance mo eh. Pag
usually
naumpisahan
ganon.
mo na eh.
Usually ganon. Pero kung minsan, pwede mong i-adjust ng konti. Kung nakalimutan mo, pwedeng okay lang. The next day, balik ka naman. No? Pwede rin. No?
Opo. Umaga ako nainom doktor kasi sabi umaga. Pero doktor, yung ininom ko na para sa anti-cholesterol, dati uminom ako ng gabi.
Oo.
Pero ngayon, napanood ko sa FB yung doktor, Ate Doc ba yun na tungkol doon sa atorvastatin na
Oo.
hindi naman daw gabi iniinom, pero any time of the day. Kaya iniinom ko na yun ng morning.
Okay.
Okay lang ba yun, doktor?
Pwede. Pwede. Basta tingnan mo na lang, basahin ninyo. Nothing absolute. Basahin niyo. Best time to take a medicine. No? Okay.
Opo.
So, pero hindi naman siya talagang absolute na kailangan na sundin. Kaya minsan, i-adjust mo ng konti. No?
Oh, kaya ngayon, morning na ako uminom kasi meron siyang in-explain na compared sa mga ibang statin, yung atorvastatin daw, pwede naman daw inumin any time of the day.
Yeah.
Kaya uminom na ako ngayon. Obserbahan ko kasi magpapa-blood test ako sa next week. Tingnan ko lang kung anong resulta ko.
Okay.
Okay po.
So, sige. Age factor rin sa iyo. Ako rin, age factor.
Opo. Opo.
Age saka
Pero
yung...
awa ng Diyos, doktor, hindi naman siya yung parang controlled naman so far.
Yeah. So, i-maintain mo lang. Ang importante, huwag mong dagdagan ng stress. So,
Opo. Kaya ako nag-exercise every morning, mag-walking.
Okay.
At saka healthy diet.
That's good.
Opo.
So, habet yung sa'yo, paano yung sa'yo? During the pandemic, tumaas?
Hindi, yung di ba may injection yung first injection?
Injection sa?
Yung anti-COVID.
Oh, ayan nga, vaccine. COVID.
Doon nila na-monitor kasi nung unang 200 over 100.
Ay, bago ka
Tapos-
magpa-COVID injection. Bago
Oo. Yung after the COVID, di ba meron nang ibibigay na parang yung 3 injection?
Oo.
Yon. Yung first injection na yon, I was there mga siguro 8 o'clock in the morning. Na-inject ako 5 o'clock in the afternoon. Nagkagulo nga sila dun eh. Kasi sabi nila, wala ka ba na-feel? Mambet, sabi ko, wala. Yung sa neck, yung namumula. Sabi ko, nakikita niyo naman kung namumula ako. Wala. Tapos talaga pinalagyan na nila ako ng under the tongue. Hindi pa rin bumababa. So lahat ng mga cardio doon, nag-akyatan na. Lahat ng cardio doon daddy, doktor, nag-akyatan na. Pero hindi, sabi ko, wala naman talaga ako nararamdaman. Tsaka hindi ko alam na aabot na sa ganito. So, binigyan ako ng clearance si Dr. Tess siguro magpa 5 o'clock kasi ang BP ko went down to 160/90. Although mataas pa rin daw yun. Pero hindi alam ni Dr. Rodis yun. So, nung nagkita kami ni Dr., sabi ko, Dr., baka bet naman nini-nervous ka during that time. Hindi ko alam. Hindi ko alam yung nervous, hindi ko alam yung takot. Basta wala ako na-feel. Pero lahat na doon na nag-a-assist ng mga fellow residents, yun ang nakukuha, 200/100. So, bali tatlo kami. Yung driver ni Dr. Sino ba yung yung surgeon? At saka yung kay Dr. Huko, kaming tatlo. So, yung mga kasama ko, hindi magbabaan kasi nga, hindi pa ako na-inject. Noong mga 5 o'clock, yung 160/90. Tapos tinatanong kung meron ba akong nararamdaman. Sabi, wala naman. Tapos nagpa-test naman ako. Hindi ako pinainom ni doctor ng anything. Kasi sabi niya, Bet, baka naman yung incidental na gano'n. Kasi kung wala. Kaya lang si Dr. Lianes, pinainom niya ako ng Twinsta.
Twinsta.
So, iniinom ko, every night before going to bed. Pero since after that, ang BP ko naman is 110/120/70/80. Pero tinutuloy ko pa rin.
Hindi mo pa tinitigil. Hindi mo isda.
Hindi.
Okay.
Tapos, di ba nagpapa-blood test naman ako. Okay naman siya. Okay naman yung cholesterol. Okay naman. Although tataas ng konti, pero within the normal limit pa rin naman. Tinutuloy ko. Pag nalaman ni Rodis yun, magagalit siya.
Magagalit na umiinom ka.
Magagalit yun kasi ayaw niya magbigay ng medicine. Kaya lang si Dr. Lianes, who was there with me, ayaw niyang sabi niya, mag-take ka na lang, take mo. Tapos nagpapa-blood test ako, pinakikita ko sa kanya, pinatutuloy niya. Kasi pag pinakita ko yun kay Dr. magagalit siya.
Okay. Yan ang sinasabi ko kanina, Jeng, di ba? Sabi ko, we have to learn how to manage it on our own. Kasi maraming variations yan, di ba? Ibang opinion ng doktor, saka yung sa iyo mismo nagpa-fluctuate sa yung sarili, di ba? Sa gabi, kumisan normal, kumisan mataas, no? Ganon, no? So, kung mataas, i-identify mo lang yung cause, baka temporary lang yon, no? Okay. So, yung sa kay Abet, hindi ko rin, kasi mahirap i-identify yung cause, bakit during that day, mataas, no? Before the injection, no? So, baka hindi mo lang nararamdaman, talagang may hypertension ka na, di ba? Kasi kung kaya sabi ni Dr. C, baka incidental lang yan, baka
Yes.
nervous ka, pwedeng yung mga stress na yun, pwede kasi mag-cause ng ng increase ng blood pressure, no? So,
Sabi nga niya, in denial daw ako sa yung parang nervous kasi i-injectionan ako, parang ganon. Sabi niya, baka in denial ka lang doon sa feeling mo na sinasabi mo wala kang nararamdaman, pero actually it shows with your BP. Pero after that, bumaba naman na siya.
Okay. Yeah, pwede rin kasi knowing you, takot ka sa injection, baka tumaas talaga. Okay.
Takot.
So what you can do also, kung pwede mong bawasan konti o tigil mo 1 or 2 days, wala mang yan, hindi man titingnan mo kung ma-maintain mo sa normal, no? Okay.
Exercise. That's what I'm doing.
Yeah, exercise is another one. No, dapat may exercise, may diet, no? Pero yung gamot, no, whether you need it or not, yan ang question, di ba? So, pwede mong nasa iyo, if you can stop it for a while, 1 day, 2 days, i-check mo yung blood pressure mo, i-monitor mo, no? 1 week. Eh kung normal na, baka ibig sabihin, baka tama si doctor, hindi mo kailangan. Ganon. Kung bumabalik, pag bumalik, edi i-resume mo na lang.
Kasi sasabihin pa nun, ba't ka uminom yan? Hindi naman ako nagpapaano sa'yo. Kaya lang si Dr. Lianes kasi, sabi niya, ayun, pero normally, pinamomonitor niya sa akin yung pulse rate. Sabi niya, if it went up to 100 above, pwede. Pero kung normal naman, it's usually, sabi ko, 75, 78. So, sabi niya, you're okay. Wala ka namang ano. Pag
Okay.
mabilis yung takbo ng puso, tsaka yung ECG, pina-ECG niya ako, normal naman. So, yun. Hindi.
Yeah. So, yan ang for everybody, yan ang sample ng maximalist saka minimalist.
Yes.
Si Dr. Llanes, maximalist, si Dr. Sam,
Mm-mm.
minimalist.
Conservative.
Oo,
Like you. Yung
minimalist.
conservative treatment.
Kung di kailangan, wag naman, no? Okay. So,
Bakit Dok? Sabi naman po, pag po once na nag-take ka na ng gamot sa high blood, masama pong itigil.
hindi naman, basta wag lang yung hindi, kahit na one day, pwede naman, kahit na, kasi hindi mo maring maiwasan yun. One day, makakalimutan mo, no? So, huwag ka na matakot. Sabihin mo, sinabi sa akin, hindi pwedeng itigil. Baka matakot ka na. No? Pwede, no? Basta,
Oo. Minsan po gano'n, nakakalimutan ko. Kinabukasan na lang po ulit ako nainom.
Ganon. And then, you take it. Only talaga kung proven na talagang hypertensive ka na yung pala, hindi nawawala. No? So, dapat may maintenance ka na. Yung kay Abet kasi di pa natin proven kung talagang baka transient lang yan, incidental lang. No? Okay. Yung sa akin mismo nga, nung umpisa, wala rin ako nararamdaman. Nung sumali na ako sa isang research study, minomonitor yung blood pressure ng yung mga subjects sa study. So may holter ako, yung minomonitor blood pressure over kahit nasa gabi, no? Tulog ako, andyan yung blood pressure, kaya hindi ako makatulog no? Pinapump every hour, pinapump yung kamay ko, no? Habang tulog ako. During that time, maabot ako ng 210 sa gabi. So tinanggap ko na. Talagang may hypertension ako kasi minonitor na. No? Kaya umiinom na ako ng anti-hypertensive. No? So pero ina-adjust ko rin on my own. No? So dati-dati, amlodipine lang ako. No? Na-maintain ko sa 140/90. No? Kasi sabi ko sa edad ko, pwede na yon, di ba? So hindi mo kailangan mababa. Then, and last about 3 months ago, sinubukan ko dagdagan ng losartan. No? So nung dinagdagan ng losartan sa gabi, nagiging 130/80. So bumababa pa, pwede pa pala. So yun, so minamaintain ko lang sa 130/80. Kaya lang, ang isang problema ko, nagka-cramps ako every so often sa morning. Ang sakit.
Because of the amlodipine.
Most likely, amlodipine. Nung may isa akong kakilala ng doktor na galing, nung nag-mission ako, sabi yung US na Pilipino, sabi, mag-calcium ka rin. Kasi amlodipine yan So nung nag-calcium ako, additional calcium, kasi calcium blocker yung amlodipine Kaya nabawasan yung cramps ko. No? Ganon. So, binabawasan ko ng amlodipine ko from 10 to 5. No? Pero mukhang tumataas ulit Kaya mukhang ibabalik ko sa 10. No? 10 milligrams ng amlodipine plus losartan. No? Pero baka eventually, baka tanggalin ko yung amlodipine kasi ang sakit kasi pag nag-cramps ka, ang tagal, 15 minutes. No?
Tsaka buti, doktor, hindi ka nagmamanas sa amlo. Kasi nakakamanas ang amlo
Yan sinabi sa literature, di ba? Magmamanas. Ako hindi. Baka yung exercise ko kasi nag-i-squat ako everyday, squatting.
Yeah, exercise also.
Exercise. No? Baka ganon. No? Okay. So, ano pa? Sino pa mag-share? Maria, anong sharing mo?
Like Miss Beth, meron na ako talagang hypertension. But then nung COVID, when we were supposed to get the first injection, so ang daming tao, as in, tapos, kasi ang ginagamit nilang monitor yung digital.
Oo.
3 beses akong kinunan po na digital. No? Naku, hindi pwede kasi 149. Until finally, the last nurse who took it sabi, ma'am, pumunta kayo dun sa yung hand, talaga, yung regular BP monitor, yung
Oo.
hindi yung digital. Ayun, normal. 130/90.
Sensitive kasi ang digital eh.
Oo, pag digital, very sensitive. Tapos syempre, I was also a little edgy, tense.
Yeah.
So ayun, sabi
And to
ko,
add, Doctor, ano pala, sabi pala sa akin ni Dr. C, maybe because kasi mataba ka na, tumaba ka na. Dati naman hindi ko mataba. Sabi niya sa akin, balik mo yung dati mong weight. Sabi ko, I'll try.
Oh,
Yun yung
binalik mo
sinasabi
na.
niya, baka kasi mataba ka na. Dati hindi naman ganyan, ang taba-taba mo na.
Ayun,
Ganun yung
tama.
magsalita
Pwedeng
eh.
tama siya. Di balik mo yung weight mo para itigil mo na yung gamot
Oo,
mo.
sinasabi, balik mo yung weight mo. Yung dati mong weight, hindi yung ganyan, ang laki-laki mo. It's like, ganun na ba ako kalaki?
Oo. Oo, yung weight naman also is an important factor sa blood pressure. No? Okay.
Yun ang minomonitor niya sa akin eh, yung weight. Sabi niya, ibaba ko ng 10 pounds yung weight ko.
Mhm. Yeah, Maria, ano?
yeah, yung weight rin ho, because nung itong pandemic talaga ho, I really gained a lot. Tapos, I lost 10 kilos na. Tapos, I noticed, bumaba rin yung ano ko, when I monitor my BP, when I take it. Mababa ho from before. Significantly lower. So, yeah, it's true. It's true that there is a correlation. Pwede gumawa ng thesis ho. Hypothesis, yes. Is there a correlation
Okay.
between weight and hypertension?
Okay.
Yes, there is.
Sige, daw sa lessons, yung mga matataba, bawasan yung weight ninyo para number 1, kung may hypertension kayo, baka bumaba. Okay. So, any more? Kung wala na, thank you for sharing your experiences. No, I hope we have learned from each other and also learned something that is basic in the management of hypertension. No? Okay. As I said, wala tayong nararamdaman, no, but pero importante yun. It's a common cause of stroke, no, heart disease, saka kidney problem. No? Okay. So, aside from, yeah, yan ang another. Actually, between heart disease, cardiovascular disease, and cancer, mas mataas ang problema sa cardiovascular disease. Diba? Okay. Okay. So, let's call it a day. We'll talk about another topic next week. Next week will be, can we skip radiotherapy? Radiotherapy for breast cancer. No? Okay. So that's yun ang very common questions din ng mga pasyente na may breast cancer. Okay. Kadalasan tinatanong nila kung kailangan ba ako mag-radiotherapy, di ba? So, even after chemo, pinapa-radiotherapy, no? So, palagi ako tinatanong, ang current practice ko is as indicated kung kailangan lang, minimalist, di ba? Yung iba naman, maximalist. Diba? So, for those, si Shirley Magbuo, si Ellen Beloro, si si Lorly, Phoebe tsaka si Lorly, nag-radiotherapy ka? Phoebe?
Ako, Doc.
Okay, sa PGH ka no? Okay.
Opo.
Okay. So, baka because of some indications, baka maraming nodes, no? Okay. Si Phoebe, nag-radiotherapy ka ba, Phoebe? Hindi.
Hindi po.
Okay. Yeah. Sorry, pag dumaan sa akin, I do it as indicated. Pero napapansin ko sa government hospital, sa mga medical onco, maraming pinapa-radiotherapy, which might not be needed. No? Okay. So yan, i-discuss ko next week. No? Okay? So if there are no more questions, thank you for attending this pep talk. We'll see each other next week. No? Okay. Have a nice day. Bye-bye.
Kayo rin po.
Thank you po, Doc.
Thank you, Doc. Thank you so
See you
much.
next week.